Well, by the time you take the material out of the tooth, you don't have a whole lot left. And back in the 70s, we would have done Peter K. Thomas anatomy, put some Coltine whaled-in pins. Thank you, Coltine, 4 of them at least. Hopefully don't go outside the root, and hopefully don't penetrate into the pulp chamber. Put some copalite in there and just keep on mixing. But this is different. This is a different time. This is a different era, and we can manage these stresses. The matrix band here is an Omni band from Ultradent. You can use Garrison bands. There's a lot of good ones out here, Triodent. But I like the Ultradent Omni bands. Are disposable. They come in Mylar. They come in dead soft, amalgam, distal extension, pedo. And at least with a Mylar band, you can get the light in there. Again, there's other good ones as well. We would do, according to the criteria here, it is a total etch technique. I would probably put Conceptus in first as the first liquid introduced, rinse, and manage the tooth that way, doing a total etch technique. Rinse and dry. Again, dentin shouldn't be totally dry. It should be damp. So if you over dry, I would re-wet with a cotton pellet with a little bit of water, any of the re-wetting agents that you want. This is the ParaBond now. This is ParaBond A and B. You mix them fresh. Under no conditions do you open up these caps until you actively are placing the material, because otherwise you lose your chemistry and the volatility of these adhesives. You mix it, you mix them together, you massage it in for 30 seconds, and then you lightly air dry. When I say that, there's no universal standard. The dentist should do this, not the assistant, because when you blow with a vortex of air, a high velocity, where does your adhesion go? Does it stay? So a very light air stream to just let the chemistry work, and do not light cure at this point. And then what you do is take the cannula and just start at the gingival box, go back and forth, keep the cannula under the composite material, and don't take it out. You may introduce air voids, go back and forth, back and forth. Actually, I'm not trying to be funny about this, but this is my sonic fill by moving my hand around here with the cannula of the material. You get 1 minute to do this. It's pretty easy. You could take a cotton swab, cotton pellet, and kind of pull it around as you wish, or any of the instruments you want before you light cure it. Light cure for 5-10 seconds. Heck, there's no harm in doing a little bit trans enamel polymerization from the buccal, the lingual. I'm not one to rush into these things. I let the set time go to 2 minutes, and then I just do a nice job on the rotary, finishing down and polishing with the materials of choice, albeit Coltine or others, whether there's clinician's choice. Shofu makes good ones, Ultradent makes good ones as well. But that's what it is, a wonderful transitional interim material to see how the tooth performs before you find what is your next generation of material.